Good morning. Welcome. My name is Mark Dilatosh. I'm with New Patients Incorporated. We have dentists call all the time, probably 15, 20 times per month, and they ask us to judge the viability of investing some of their marketing dollars into a certain print media. Let's first define print media. Print media can be almost anything. You would recognize them immediately as newspapers, magazines. Those are the two, newspapers and magazines, that most dental offices will recognize as the print media. And when you go through an assessment, there's a million things to take into consideration. Probably have 2 videos on this subject before it's all done, because there's a lot to talk about. The first thing that you do when you evaluate a print media is look at the distribution. Because if, for instance, let's say that you're in a market and the print media distribution is 180,000 people, households. 80% of that investment in ad space in that medium is going to be waste. You can't possibly, or you wouldn't possibly draw that far away geographically someone to your office, or at least your chances of doing so are almost nil. Okay, so the first thing you look at is geography. Now, when it comes to newspapers, there's another way to promote within newspapers called newspaper inserts, which are geographically targetable. Newspaper inserts are those annoying things that fall out of your newspaper on Fridays and Saturday mornings. Normally they're shopper guides from the local merchants who are trying to capture the weekend shopper. As a dentist, you wouldn't use them on Fridays or Saturdays because you don't want to be mixed in with everybody else, and you don't have any phone coverage typically on Fridays and Saturdays. So what you would do is do an insert, say, on a Tuesday or a Wednesday when there's no other inserts in the newspaper, and when you could possibly be the only insert in the newspaper, and when you have the most daily phone coverage all day and hopefully all evening, because some of these calls will come in after normal office hours. So that's one way that you can target geographically using a newspaper that potentially has a distribution of 200,000 people, whereas if you placed an ad, 80% of that dollar that you spent to place the ad would be wasted with inserts. You can target them geographically. Typically a newspaper will have zones. Zones are blocks of geography immediately surrounding your office, and some of them way away from your office. What you would do is you would select these zones of distribution closest to your location. They don't always work out perfectly to a circle or to a square, with your practice as the dead center. It almost never works out that way. But most of the time you can choose zones, geographic zones that the inserts go to, where it's easy to travel to you from. That's key. Got to have a road connecting the receiver and your practice. It has to be an easy road. Your practice has to be relatively convenient off of that road, or even on that road would be great. So you, with an insert, your marketing dollar is being concentrated. 90% of it is not wasted. Maybe you have 10% waste, but 90% of your dollar is going to people who have a much greater chance of choosing you. And there's about a 99% chance that you're going to be the only dentist in that magazine, in that newspaper, who did an insert that day. You can't normally say that about print ads. Normally, if you open up a newspaper, almost any local newspaper in the United States, if there's one dentist advertising in there, there's likely going to be more than just one. So that speaks to media dilution, which we're going to get into in a different video. So for the purposes of this video, I wanted to discuss the print media, in particular newspapers, and the two ways that you can advertise, either through a print ad or a newspaper insert, and I wanted to give you the pros and cons of each. Newspaper ads have their own pros, and we'll discuss them in future videos. But that was the purpose of this video. I hope you got something out of it. I hope it helps you. If you have any other questions, just call me, 866-336-8237. You can email me. That's fine. Mark D, M-A-R-K-D, @newpatientsinc.com. And I hope it was helpful, and thanks for watching.